Hi guys, I'm going to do a video on alterations in cardiovascular function. Throughout this video, I am going to ask you to stop the video and watch the supplemental videos that I have placed on D2L. At the request of many of you, you like very simple, quick YouTube videos. So I have tried to add several throughout this presentation to aid in your learning. So those videos cover the pathology, and I'm going to really just talk about what the nursing job is going to be in all of these issues. First video, stop and watch the flow of the heart and use the outline that I gave you, the coloring page that I gave you to really learn and trace the heart. Color it, use arrows, use pictures, have some fun with it. Draw your own picture of the heart if you don't have one of the handouts, and make sure that you understand how the blood travels through the heart and what valves open and shut when, so that you can understand what the heart's doing in practice. There are, again, several videos that are posted on D2L to cover this for you. This gives you a written breakdown of how the blood travels through the pulmonic valve, the left atrium, bicuspid, or the mitral valve, out to the body. Very, very important that you understand that. The left ventricle, we've discussed this before, is the biggest, best, most important part of the heart. So make sure that you understand that we want to keep, of course, the entire heart healthy, but certainly the left ventricle. When you are discussing the heart and how the blood goes through, systole is the first part you hear. And that is the contraction and the emptying of the atria and the ventricles. And then there's diastole. And diastole is the time for the heart to relax and fill. If the diastolic blood pressure is high, that means that the heart is not resting. And that is very, very important to get under control, because if the heart is not resting, then eventually that heart will give out. Normal sounds that you're going to hear are S1 and S2. That's lub, dub. This is an explanation of S1 and S2. Following this are several other sounds. There's gallops, there's S3, there's S4, there's murmurs. As a new nurse, I'm saying that as a cardiac nurse, no one is going to expect you to be able to hear those sounds. You'll hear S1 and S2 because you've already been taught to do that. If you have a client that has a different sound, it is perfectly okay to say that the sound is funny, or you hear a third sound, or you hear something but you don't know what it is. That is perfectly fine to do. And then another nurse, a doctor, someone else cardiac tele-tech can help you identify what those are. But for the purpose of what you're doing as an LPN, please learn S1 and S2, and the other ones, do not spend a lot of time, because you won't be tested on them. You will not be responsible for knowing them. Just try to hear me on that. Abnormal heart sounds, again, here's a few more ideas. No one's going to expect you to pick up on them. If you have a client in clinical that has a murmur, that has a friction rub, has something like that going on, please see if you can share it with your fellow students, because they're kind of rare. And it would be great for you to be able to hear how to do it. When someone comes in with a cardiac issue, the first thing we're going to do is an EKG and cardiac enzymes. Cardiac enzymes are made up of 4 different blood tests: myoglobin, CKMB, troponin 1, and troponin T. In an emergent situation, you're going to see troponin 1. Troponin T it kind of disappears. It kind of hangs around for a while. but you really won't see it tested that often. We're also going to, these tests all look at muscle damage. These are any muscle, and troponin is damage to cardiac muscle specifically. We're also going to look at the C-reactive protein levels. Again, this has a basis of muscle deterioration. MEG, we want to see if the MEG is out of whack so the heart can't relax. And then if someone is in the middle of an MI, or we're going to take them to the cath lab, or whatever we might know to do, we have got to know if they're coagulating appropriately, or if their PT is too high, we know we can't do certain procedures. So it's very important to do a PT and PTT. Here is the reference range for diagnostic tests. I also gave you a handout in class that shows the graphic flow of these markers. Every text, every book, as you know, is going to have a different number just slightly. For troponin, in practice, at least in my practice, it was always, if it's over 1, you have a problem. So go with what's on here. You'll want to know that for the boards. But in practice, you'll sometimes see troponins way high, 30s, 40s, on up, when someone's really in the middle of an MI. Again, to review EKGs, we will do these in simulation, learn how to read the rhythm strips. Here is one video, and there I think are several other videos that are on D2L for you to learn how to do EKG strip reading. I'm not going to go over it here in any specific amount because we will do that personally, but please watch those videos and practice. In your packet, you have tons of EKG practice strips. You can also Google nursing EKG strip review samples, and tons will come up for you to work on. This slide tells you how to read the EKG paper. This one tells you how to define what kind of heart rate it is. And this is probably my favorite slide because it gives you step by step what to do. First thing you do, you question, is it a regular heart rate? And for this one, you can tell it is. If you measure here to here, that's the same measurement as here to here, which is the same as here to here. And you can just see, very, very regular. What is the heart rate? This is a 6-second strip. And for any testing in nursing, you will always be given a 6-second strip. So you can take this 1, 2, 3, 4, 5, 6, 7, 8. Take that times 10, because there's 60 seconds in a minute. So this heart rate is in the 80s, or right around 80. Then we want to ask, is there a P wave? And the P wave is this little wave right here. And we have one there, and we have one there, 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 there. That tells us that this is a sinus rhythm. And this is normal sinus rhythm because it's regular. The heart rate is 80, and a normal heart rate is 60 to 100, and it has a P wave. Then we're also going to teach you how to measure the PR interval, the QRS interval, and the QT interval. For your current practice, you need to know how to measure these, but you don't need to be able to diagnose based on those numbers. So please focus on this, and then just know how to measure this. And again, don't spend hours and hours learning strips because you have lots of other content to learn. If you can do these 3 steps and know the basis of measurement, you will be just fine for this course. Now we're going to talk a little bit about diagnostic tests. These 3 videos were embedded into the PowerPoint. So if I were you, I would open them and watch them now so you get a great idea of how these tests work. A stress test requires very minimal prep from the nurse. Depending on the time of the day, they'll do a stress test with the patient NPO just because it does stress their body. If the patient is healthy and can walk, run, they'll put them on a treadmill or a bicycle. If they aren't able to do that, then they will induce the stress with medication. And that does require some, they need to be NPO. They can't have certain medications ahead of time. So there is a little bit more involved when you have a medicated stress test. But again, what you really need to know are just the basics. We're going to put the patient on a treadmill. We're going to watch their blood pressure. We're going to watch their heart rate and then see how all of that works together with a continual EKG to make sure that their heart is healthy. Thallium scan, the biggest deal is patient education that they can't smoke or have caffeine at least 4 hours prior to it. When I was in practice, we wanted at least 12 hours. So that was our protocol. Everybody might be a little different, but go with what this says. And the big deal is no caffeine, because caffeine then negates this medication here. And then a cardiac cath, pre-op, we want them NPO. There's certain meds we give, certain ones we don't. Anticoagulation will be specifically ordered by the doctor. And post-op, pressure on where we went into the artery, which is usually the femoral artery in the groin. Now they're doing more radial. We want to keep that limb still. We want to be checking the pedal pulses. Those are the most important things for nursing when doing a cardiac cath. So make sure that as you're learning these, that you're not focusing on the drugs and what the doctor's doing and what the doctor's job is, but what is your job? And your job, of course, is keeping them safe, watching their vital signs, and again, all of the steps for cardiac cath, which we'll go into a little bit later also. Now we're going to talk about occlusive issues with the heart and alterations in cardiovascular function. So the two main things that cause problems are arterial sclerosis and atherosclerosis. Pause the video now and you can watch videos I added on D2L regarding these two. Arterial sclerosis has to do with the actual vessel itself, the artery. It is thick, it's no longer supple, it can calcify, get hard. People who have hypertension usually can develop arterial sclerosis. Diabetics can develop both arterial sclerosis because the glucose causes that lack of elasticity. They can also develop atherosclerosis based on buildup of plaque, and glucose, of course, is its own worst enemy. And it, just imagine if you leave sugar and water together, what happens? You get this nice big sugar clump, and that's kind of how a plaque can develop. Again, there is a video that explains the two and the difference in them. Risk factors: hypertension, diabetes, so on and so forth. Those two occlusive vascular problems can also be part of what causes a myocardial infarction. If someone has a plaque buildup in the coronary artery, or the coronary artery has become stenotic or stiff, that can cause a myocardial infarction. And carotid stenosis, again, happens when the carotid arteries become too stiff for the blood to go through. There is a video on myocardial infarction as well as carotid stenosis. This reviews arterial sclerosis and atherosclerosis again. It's exactly the same slide. And what is the nurse's job? So when you look at arterial sclerosis and you look at atherosclerosis, think about education to prevent the two of them. At this point, I am going to stop this video and we will start up on slide 20 in the next video.